Good afternoon, everyone. Welcome to our PAAI lecture. It's entitled Acupuncture for Lower Back Pain, to be conducted by none other than our very own PAAI Board of Trustee and Secretary, Ms. Rochie Cagara. But before we start, I would like to remind everyone to please mute your microphones. You can take down notes of your questions and write it down at the chat window for the speaker to go through later. The microphone will be virtually passed on to you should the speaker or host require you to or request you to speak. Okay? Thank you. Now I turn over the microphone to our speaker, Ms. Rochie Cagara. Let's give her a warm welcome.
Good afternoon, everyone. Okay lang ako? Naririnig niyo po?
Okay lang po.
Sige,
Go ahead.
sige. So, actually, I thank those who helped, especially Jackson, kasi I belong to the generation of digital immigrants. Hindi ako masyadong magaling with the use of the digitals or the gadgets, but I just would like to say that everybody has to learn this one because this will be part or bahagi na to ng ating tinatawag na new normal for education or information sharing. So once again, good afternoon. So my lecture today is about acupuncture for low back pain. So actually, this was chosen. This is still in line with the lecture series which is provided by PAAI for free. Actually, this is done to help in the management of COVID patients and also in managing problems affecting health workers who are taking care of COVID patients or those who are under quarantine. So why low back pain? Because this is one of the common problems that especially health workers are experiencing in the care of patients in the COVID ward or in the other facilities, especially if they are going to use the PPEs that are usually required in the care of these patients. So, how do we, so ano ba yung low back pain? So, pain, this is pain that is experienced with the patient anywhere in the back region, including buttocks, below the lower border of the rib cage, which is approximately at the level with bladder 21 or ratio. So bladder 21 meaning nasa ito, medyo nasa baba ng konti ng ating thoracic vertebra, 12. Tama ba? And then, before we go into the treatment, we would like to see also the organs and the channels that are having a strong influence on the lower back area. So one is the bladder channel. So the main channel flows along the back in two lines, as you could see in the picture. And the bladder muscle channel, or the what we call the tendinomuscular channel, follows the muscle alongside the spine. And the bladder divergent channel flows alongside the spine also. Okay, so the divergent channel, these are channels which may not have acupuncture points along its line. But why is this significant? Because they are having its connections to the main channels, which is the bladder, or main or primary channels, which is the bladder. And then also the kidney. So same with the bladder, its main channel starts from the perineum, or from the perineum flows up along the spine and goes to the kidneys and bladder because they connect or it connects to the bladder and kidneys directly. And of course, the kidney muscle channel or the tendinomuscular channel flows alongside the anterior aspect of the spine. And of course, the kidney divergent channel flows upward with the bladder channel at the level of bladder 23, and it joins with the girdle vessel. So the girdle vessel belongs to the eight extras. Hindi siya main channel. And then also the governing vessel, which is closely related to the kidneys, flows along the spine. And the penetrating vessel, also stemming from the perineum, stands up, a branch up into the spine to the level of bladder 23. Okay, so before we treat our patient, we have to know the specific cause. So we have to discuss the etiology. So there are basically seven possible causes. So one is excessive physical work, such as regular lifting of heavy objects, so long-standing excessive exercise and others. And excessive physical work, if we look at the COVID pandemic, these are usually experienced by our frontliners, mga health workers who are directly taking care of patients in the COVID ward, and those who are manning the mga checkpoints to to monitor the coming in and out of individuals from certain localities. And the second one is excessive sexual activity, uh, um, and then pregnancy and childbirth, invasion of external cold and dampness, overwork, inadequate exercise. So while excessive physical work causes low back pain or lower back pain, inadequate exercise also causes low back pain. And of course, our emotion, the emotion that is basically associated with the kidney is here are right kidney and the urinary bladder. So if we will look at it one by one, for the first one, excessive physical work, particularly regular lifting of heavy objects and other activities, it causes stagnation of blood and chi. Okay? And it also weakens kidney chi because as we exert physical activity, chi is being used by the body, and if the work becomes excessive, there is a possibility that the chi becomes depleted or weakened, leading to kidney chi deficiency condition. And of course, excessive sexual activity, it depletes kidney chi also, and deficiency deficiency of chi could lead to the failure of the kidney to nourish and strengthen the back muscle. And then the third one is pregnancy and childbirth. So it also causes stagnation of chi and blood and leading to the weakening of kidney chi. However, it is said that according to Mashosha, he said that this only happens in women with weak constitution. So even if women may have several pregnancies, but if she eats uh, nutritious food, regular meals, and others, this weakening of kidney may not happen at all. As I could recall, many of the women that I have encountered in the rural area before who might be having, uh, sometimes there were those who had been having 20 or almost more than 10 pregnancies, and yet they are healthy and were able to reach old age, maybe because of the stress-free life that they had before and the nutritious food that they were eating in the community. And of course, invasion of external cold and dampness, which could also be experienced by many of our health workers because most of our health facilities, who are working in the health facilities, are now air conditioned, and um, they are usually exposed to cold and dampness within the environment. So exposure, um, especially if prolonged and frequent or repeated exposure to cold and dampness could lead to invasion of pathogenic cold and dampness into the muscles, the sinuses, or the ligaments and tendons and channels of the back. And it can cause both acute and chronic pain. So if the exposure is short and still damp, it may cause chronic pain. But if the exposure is repeated, frequent, and prolonged, it will also cause or lead to chronic development of pain or chronic problems. So chronic conditions can impair or weaken the kidneys, which might lead to deficiency of Qi and formation of dampness. And then number five is overwork. Working long hours without adequate rest for many years depletes the kidney yin. And with a deficiency of yin, it could also lead to the failure of the kidneys to nourish the lower back. And the number six is an inadequate exercise. This affects people who engages in sedentary work, like those who are working in offices and establishments where they often or most often just sit down like mga call center agents, bank employees, and others. And lack of exercise leads to the weakening of the spine ligaments and the joints because of lack of activity, and especially when combined with poor posture. And then number seven, emotion. Of course, we knew that fear or fright is an emotion that is closely related with the kidney. Fear or fright impacts the functioning of the kidneys, and it ultimately weakens the kidneys, causing Qi to become depleted or to become deficient. Okay, so for low back pain, there are three major TCM patterns. So one is retention of damp cold. This is secondary to exposure, and its characteristic, I only wrote or included the major characteristics, but of course there could be other characteristics that should be included in here. I did not include specifically the signs that we could find in relation to the other of methods of diagnosis, like the pulse and the tongue, looking at the tongue, or viewing the tongue. So this could be added into this list of characteristics. So if there is retention of damp or cold, the characteristic would be, or the type of pain is, will become worse in the morning because within the 24 hours during the day, the morning or dawn is yung pinakamalamig. And it is usually relieved by heat and aggravated by exposure to cold and damp. And also, another major characteristic is stiffness, contraction of muscle, and severe pain when cold predominates, like exposure into in an aircon room, and aggravated by rest and relieved by movement and application of heat. So swelling because of dampness also, and numbness and feeling of heaviness when, of course, when dampness is present. And the other DCM pattern is stagnation of chi and blood. So the major characteristics include severe and stabbing pain. This has something to do with stagnation of blood, especially because the pain in chi stagnation is milder and is relieved by massage or movement. And usually when the person engages in activity, it slowly disappears. And another characteristic is rigidity and stiffness of the back muscles could also be observed. And the third TCM pattern that we could see among patients with low back pain is kidney deficiency conditions. It would depend on whether it's Qi deficiency or Yang deficiency or Yin deficiency condition. So, but generally, this could be the characteristics that we could see in patients with kidney deficiency condition. Pain is dull and comes in bouts and relieved by rest and aggravated by overwork and sexual activity. So why aggravated by overwork and sexual activity? Because when we work, when we use our energy, the already depleted chi of the kidney will become more depleted. And so also the same with sexual activity. And cold sensation when it's caused by kidney yangshu. And in addition to this, when you look at the kidney with yangshu condition, on Sagitoy, what would be the characteristic of the tongue? It might be wet and of course pale or white. And of course, this is more common among middle age and elderly because we know that as we age, our chi becomes depleted as the body or as individuals become or gets older. Um, our chi level also decreases. Okay, so of course, to be able to see these patterns in our patients, we have to utilize our TCM diagnosis. These are the four methods: asking or interviewing in the biomedical um, framework, then looking is the inspection, and of course, listening and smelling. So in asking, we ask question in terms of the the factors that we have mentioned earlier if it is present. So like for example, we will ask the patient or in asking, we will utilize the eight traditional questions in TCM. And then in looking, we have to look at the different parts of the body, the tongue, the color of the skin, and others. Of course, listening and smelling, we have to listen to the voice, um, the odor of discharges and others. And of course, touching. For touching, we will be able to assess for the temperature of the skin, if there is coldness, if it's hot or not, if there is dampness, the characteristic of the sweat, and of course, in here we can appreciate, so we will be able to know the kind of pulse that our patient has, especially in the area of the kidneys. Okay, so of course, with the three patterns predominant in patients with low back pain, the treatment objectives are to expel or dispel dampness, cold, or damp and cold together. And the second objective is promote the proper circulation of chi and blood. And the third one is to tonify or strengthen the chi and or blood. Okay, so let's go now into the treatment. But would you like to ask some questions before we proceed, or we will just have the open forum after na lahat?
Might be good to have it after na lang. So far, there's no question being typed yet.
Okay, so for the treatment, we categorize it into acute and chronic conditions. So for acute conditions, the common pattern is the invasion of cold. Um, so this is not the damp cold that is generated due to kidney yangshu, but this is damp cold uh, affecting the channels due to exposure to environmental damp and or cold. And then of course stagnation of chi and blood, as we mentioned earlier, the possible causes of stagnation of chi and blood could be um, like excessive work, um, working without rest, and so much bending and lifting. This could lead to blood stagnation. And in acupuncture treatment of low back pain, we utilize, we have there are two sets of points. So one is while we use local point, we can also use distal points. Okay, so for distal points, usually distal points are recommended to be used first before we apply the local points. So like for example, the Yao Tong Shui affects the upper part of the back on the left side. And then SI3 could also have its influence on the lower back. And then bladder 40, just above the buttocks. And we have bladder 62, your GB26 on the middle at the middle of the back. And then you have your bladder 50 is affecting the posterolateral side of the thigh. Okay, so for distal points, these are the specific points that we could use. Um, One is bladder 40, the wisdom. This is the earth and the whole point of the bladder, and it strengthens the waist and relaxes the tendons. This is one of the commonly used points when we do acupuncture to our patients. And then another distal point that we could use is Dumai, or we also call it GB26 or Rinzong. And this is known to calm the mind and relaxes the whole body, including the muscles of the lower back. And then the third one is, or third important point is SI3 or the small intestine 3 because it also relaxes the muscles and tendons and it strengthens the chi. Okay? So it has a similar effect. So pare-pareho yung epekto ng bladder 40, GB26, SI3. Their common benefit is relaxation of the muscles and tendons. And then another distal point is Yao Tong Shui. Yao Tong Shui is located at the dorsal side or the back of the hand. So it's on the dorsum of the hand midway between the transverse wrist and the metacarpophalangeal joint. So meaning transverse wrist to middle. Okay, and the exact location is one point between the second and third ulnar bone. This is the second, the third, so it's here. And um, another point is between the fifth metacarpal joint. Okay, so it's here. Second and third, fourth and fifth. So we have to puncture both points. So meaning we will insert two needles in on each hand. Okay, it's useful to move chi and blood in the lower back. So although it's quite far, but it has a strong influence on the lower back. Okay, another distal point is bladder 58. It's located at the calf muscle at the posterior side of our leg or back of our leg, and it is a low point and indicated for pain in the calf, head, and lower back. So it has direct connection to the kidney channel. And bladder 59, that's bladder 59. I missed to write the BL, but it's bladder 59, C cleft of bladder yang shao vessel. So it activates the meridian and benefits the lower back legs and also alleviates the pain. As far as I could remember with Chicklif Point, it's where most of the chi in that channel accumulates. So it has a rich supply of chi that could be circulated in not just the back and the legs, but also including the back, the lower back especially. Okay, so another distal point is That's bladder 62, Shinmai. So it functions to deobstruct. So meaning it removes the obstruction. In other words, it promotes the free movement of chi in that channel, and hindi lang pala sa channel because it could help in nourishing the whole system, meaning the whole body. And it increases the movement of chi and fluids. Hindi lang chi, but also it improves fluid circulation. Therefore, uh, when we mentioned kanina na damp could be one of the possible causes of pain, so this point, bladder 62, is very good for relieving edema formation or dampness, um, not only on the lower back, but the whole of the body. Okay, so those are the major distal points that is recommended for lower back pain. And it is said that distal points are usually inserted first. And when needling sensation has been obtained, it is manipulated using the reducing method. So I think most of us know what a reducing and a tonifying method is. So hopefully we know the difference between the two. So at this time, we will utilize the reducing method. And after 15 minutes, the needles are removed. Then the patient lies down. So what I have read from Mashosha is that during the insertion of the distal point, we do it in a period of 15 minutes, and we can even ask the patient to just stand. But I think this is not possible to all patients, especially those who are fearful of needles. They cannot tolerate standing with needles on for 15 minutes. But ideally, the recommendation is we will ask the patient to stand for 15 minutes, and then we will remove it, and then we will ask the patient to lie down on the local point for the local points. So the position of the patient in the insertion of the local points is lying on his abdomen because we will be inserting the needle on the back area of the patient. Okay, so it is the selection of the point is dependent on the location of pain. Okay, for the local points, these are the recommended points. And the basis for selection is according to tenderness on pressure. So tenderness means, for the doctors, they are familiar with this, but for non-doctors, tenderness means there is pain upon pressure. And reducing methods are also used for the local points and retained for at least 20 minutes, during which time they can be manipulated at intervals. Okay? So the points are do or GB3 or do my do or governor vessel 3, then do or GB4, GB8, and I think Jackson could pronounce it very well, but I think this is pronounced as Shichi Tue Sha. And then bladder 23, bladder 32, and it is recommended that we also use the Watu Jaji points depending on the location. So for the Watu Jaji point, we will only use 3 pairs. Okay, so for the governor vessel points, what are the points that we have mentioned earlier? GB3, GB4, and GB8. Okay, so it's located here at the back. So this is 3, 4, and this is your GB8. Okay, and then for the urinary bladder points or the BL points, the recommended points are bladder 23. So this is your bladder 23. This is your bladder 32. Okay? So let's move on to the specific local points. We have for DO3 or GB3, it's also known as Yaoyang 1, and it functions to regulate the kidney chi, strengthens the waist and the knees, and eliminates cramp and cold. Okay, so it's located at the lower portion of the back. So in the previous slide, it's in here. Okay, here. And then another point is GB4 or Mingmen. It tonifies or strengthens kidney chi, tonify the yang energy of the whole body, and strengthens the back. And then we also have GB8. Um, it serves as a local point, especially if the area that is affected is somewhere at this point. Okay, and then another point, local point, is bladder 23 or Shenshu. It functions to regulate and strengthen the kidneys. It is indicated for lumbar pain and all disorders of the kidneys. In bladder 2032,Iliao, it strengthens the kidneys and regulates the lower heater. The lower heater is um, lower part of our body cavity below the waist. Okay, so another point that is recommended is MBW25. This is a miscellaneous point. This point is not along the meridians, and this is located in the depression below the spinous process of the fifth lumbar vertebra. So this is where it is. It is located at the midline, so meaning sa gitna ng likod. And this is indicated for pain of the lumbosacral region and indicated for sciatica as well. And then the last point recommended is 3 pairs of Watu Jaji points. Watu Jaji points are located 0.5 chun from the middle of the back, so sideways. So Watu Jaji points are located bilaterally on each side, half chun from the middle, so on the right side and on the left side. And um, we could insert it perpendicularly 0.3 to 0.5 shown dip. Okay? So, mukhang nasa skin lang talaga siya. So, if for example, the pain is at the, because it said you can insert in 3 pairs. So, say for example, if pain is noted by the patient at the level of, or in this area of bladder 23, you can apply Watu-Jaji points at the level of the inferior border of the spinous process of um, lumbar vertebra 1, lumbar vertebra 2, or in line with bladder 23, and in line with bladder 24, because it said 3 pairs. So meaning, parang nasa gitna yung area na pinakamasakit, lagyan mo ng needle sa taas, doon sa line ng area na masakit, at saka doon sa Watu-Jaji point below. So meaning, Watu-Jaji point on the side, Watu-Jaji point above and below. So meaning 3 pairs. This is for diseases of the lumbar and sacral region. Okay, so let's move on to the chronic conditions. And for chronic conditions, the patterns of conditions that are considered chronic are kidney deficiency. And always, it is said that it is always associated with a deficiency condition. And oftentimes, it is combined with retention of damp cold. Okay? And then kidney deficiency associated with stagnation of chi and or blood and or both. So when the condition is chronic, meaning hindi siya stand alone, hindi lang siya nag-iisa, pero kadalasan ang deficiency condition ng kidney ay may kasamang ibang problema. Halimbawa ng damp or cold or stagnation of chi and or blood. Okay, so same with acute condition, we also utilize distal and local points. So for kidney deficiency, we use or what we recommend SI3. And SI3 is combined with bladder 62. Um, this is done to open the GB channel
Also,
and to strengthen the spine and tonify the kidneys or strengthen the kidneys. Okay, needles in reverse order. So this is how it should be inserted. For men, we insert small intestine 3 on the left side and bladder 62 on the right. So meaning we will not be using needle in pairs but one on each point. Okay? So if we insert the first on the left side, so the first on the left side, the second one should be on the right side. And for women, we use four acupuncture points. We start with SI3 on the right, bladder 62 on the left, lung 7 on the left, and kidney 6 on the right. And remove this. Uh, ah, may ko lang dito. When removing the needle, you have to remove parang first in, last out. Yung mga naunang tinusok, kukunin or tatanggalin sa huli, yung maunang tatanggalin yung mga huling tinusok. And these treatments are only effective if pain stems from the midline over the spine. So meaning, if the pain starts at the middle of the lower back. Okay, so in addition, distal points would also include bladder 60. Um, so I did not place a picture because I think these are common points or these are points that we commonly use. It's the ankle. It's located at the ankle, opposite side of our kidney tree. This is recommended or indicated for chronic back pain and it also affects the upper back and neck. So, if you use this, may bonus na effect, hindi lang sa lower back ang kanyang effect, but it will also affect the upper back and the neck. And then kidney 4, it tonifies the kidney and affects the bladder channel. Okay, spleen 3, it influences the spine as well. GB 20, so it's at the top of the head. It affects the governor vessel channel. And heart 7 affects the back indirectly by relieving pain through its calming effect on the mind and it also eases spasm. Okay, so local points are selected according to tenderness and pressure. So same with the acute type of low back pain. And then another local, okay, so For the commonly used local point, we have bladder 23. It should be used in all cases of low back pain. Okay, so I think we don't need to explain its location because this is commonly used. And other very important local points would include bladder 26, as was explained earlier, and we also have another one. It was also included in the treatment of acute conditions, the she, and then she, siya. And then bladder 54 is another point. If it is specifically indicated if pain radiates to the buttocks and also to the legs. So your bladder 54 is here. Okay, it's at the bottom. And then your yaoyan, yaoyan is a little over or higher than your um, bladder 54. This is your yaoyan. This is good for local point for chronic. This is a good local point for chronic low back pain. Okay, so in the treatment, if there is kidney yang deficiency or cold with dampness on the patient's back, or if the condition is associated with cold or dampness, we apply moxibustion. And there are different ways of applying moxibustion. However, this is the simplest and most commonly used. And for this session this afternoon, these are my major references. And I would like to thank everyone for listening and hope you learned from the lecture this afternoon. Thank you very much.
Thank you very much, Miss Rochie.
Yes,
Uh,
that's fine.
let's
Thank you
see
po.
if there would be questions. You can please type it down at the chat box. While we're waiting, let's recognize the presence of Dr. Al Lagaya. Good afternoon, Doc.
Good afternoon, Doc Al.
Would you like to say something, Doc Al?
Hi, good afternoon. Good afternoon.
Good afternoon, Doc.
Yeah,
Good afternoon,
Ms.
Doc.
Rochi, thank you very much for a good presentation. Most relevant for the reason that today most of our patients are suffering from the quarantine disorders.
Yes,
Particularly, lahat na ng palabas sa Netflix na ubos na sa HBO at saka sa TV. So that means ang itsura natin palagi naka-slouch, and the topic of Ma'am Roche is very relevant to alleviate us of that back pains and along with our patients. Ngayon pa lang, may nakikita ko sa mga picture natin sa mga participants habang nakikinig sa iyo, naka-slouch eh. And that's one of the problems na nagkakaroon tayo ng mga pinch nerve or sciatica or anything. Ang concern ko lang, Ma'am Roche, could you share to them, as a practicing nurse then, would you share to them differential diagnosis? Halimbawa, meron siyang low back pain and hindi pa rin gumagaling, or anticipatory, baka may maggrabing sakit pa siya. Could you share to the participants natin ang possible other diseases other than musculoskeletal? Yun lang po.
okay. Ang share ko lang doon, kapag low back pain, we will not assume that we can treat all cases of low back pain with acupuncture. We have also to be mindful that there could be other problems like cancer or tuberculosis or maybe other conditions that could be associated with pain or maybe where kidney diseases. And while we do acupuncture, I would still, ako for myself, I would still, if the doctor would allow, um, might continue or could or would continue acupuncture while the patient is undergoing biomedical treatment. We should not think that we are the savior and we could cure all the problems of our patient that is manifested with low back pain, but we have to be mindful that we also have to refer our patients to biomedical practitioners or doctors, and would be better if we can work collaboratively with our with modern medical doctors in treating or managing low back pain with medications and acupuncture, because I do believe that acupuncture could enhance the effects of medications that doctors would usually prescribe our patients. Although there is a principle in TCM which that guides us that if the problem is chronic, it may require a long-term treatment also. But we should not say nga, ako lang ang gagamot nito. You should not go and see a doctor. But I would advise that it would be better for us to work collaboratively with a doctor, because I know that there are some doctors who are open to acupuncture, and we can discuss with our doctor and ask permission or talk with him if we could do acupuncture at the same time taking the medication that the modern doctor prescribes. Okay lang, Doc? Kulang.
Very much.
Thank
Thank
you,
you for
Doc.
that answer. Along with that, may I also ask you or any of the participants, do you have that experience? Low back pain, sometimes naikot na nila lahat ng doktor, hindi pa rin sila gumagaling. May mga challenging, medyo aggressive patients, tatanungin ka, Ma'am Rochie, yan bang acupuncture mo? Mapapagaling ako? Anong porsyento ang assurance mo na gagaling ako? Anong sagot niyo doon?
Kung ako, Doc, I would not assure the patient. I would not say nga, oo. Because um, we cannot really, hindi natin masisiguro na gagaling yung patient. Tapos pag sinabi natin, yes po, gagaling kayo, and then hindi siya gumagaling, it will destroy our practice. But usually what I do to patients who would ask me that way, I will explain how acupuncture works, and I would tell the patient na I will try doing acupuncture, but I will not promise that he will be cured with acupuncture, but with his cooperation or her cooperation, following the advices and all, there is a possibility that the condition could be cured. Doc?
Uh, excuse me.
Yes.
Here we have one question here coming from Edwin Samlero. Ito
Yes.
ba mga local points can be used for lumbar spondylosis? I think what he means is lumbar spondylosis. The question is, can these local points be used for lumbar spondylosis?
Okay, so actually, ang lumbar spondylosis could be one of the modern medical diagnosis of the patients that we have discussed earlier with those TCM patterns.
Okay. Any
So
other
basically, it could
questions?
be used, but it would be better if, as I have said earlier, we work with, or we will also ask the patient, or we will ask, I think ang protocol natin is we should work, it's better to work together with a doctor, and we will not just start, especially in your setting in Manila, because there are a lot of clinics and doctors. Siguro exception dito sa amin sa rural area, because there are instances na wala talagang doktor, so you just have to manage your patient. But in your area or in some areas where there are a lot of doctors and clinics where patients could easily go, it would be better to ask your patient to consult a doctor if pwede, so that we would also know that the condition is that, and acupuncture works or help in treating those kinds of conditions.
And another question is, how frequent are we going to treat the patient?
Okay, so if acute conditions, there are times that one session would be enough. But for chronic conditions, sometimes ako sa ako lang personally, sometimes it would depend on my availability. But initially, we can actually ask our patient to come on a daily basis if the problem really bothers our patient. And maybe we can space, try to um, increase the gap between treatment. And I have had readings that chronic conditions that may have been there for months or years may also require long-term treatment, maybe weeks, several months. It would depend on your assessment.
Okay. Uh, what about auricular acu for back pain?
Auricular, okay, auricular would also work. Diba, sa atong ear acupuncture, there are points for the spine, lower back, and other parts. Although it's just in the ear, um, but it also still has its effects on on our lower back or upper or whichever. Because sa atong ear, di ba, our ear resembles a baby that is uh, lying like a fetus inside the mother's womb, and there are points on our ears that would correspond to the different parts of the body, like lower back, upper, and all. It could also be used.
Then there's another question. How many sessions are required? So I think this is a little bit similar to the question above.
Yes.
But for clarification lang, the question could also be phrased as a case of how many sessions or frequency and how many cycles. You might actually be asking about how
Okay. So
many how many times you'll be treating a week and how many weeks you'll be treating a certain case.
okay. So I would like to reiterate na it would depend on whether it's acute or chronic. Pag acute, minsan isang tusok lang, okay na. Or few more sessions follow up. But um, there are conditions, as I have said, if it's severe really and it really bothers the patient, we may even ask the patient to come on a daily basis if it's really needed. But normally, normally, what I've learned when I had my training is um, initially we can ask the patient to come on a daily basis, like for example, 3 days daily, and then every other day. And we will complete the 10 session cycle and let the patient rest for about a week or two. And then if the problem is still there, you can have another cycle. I could just remember, although it was not about low back pain, we had a patient, a couple who did not have had children, and Dr. Wale gave 1 round, 10 sessions, twice a week. So after the 10 session, since the couple was willing to have children, they went back another session, another course, treatment course, or another round. And then the third round is over, hindi pa rin na pregnant. But the couple was so persistent and they had the fourth round. And after the fourth round, the couple had a baby. So personally, I would say we should not give up on our patient because as I have said, um, especially there are diseases like diseases affecting the joints, the bones, the tendons, are usually like arthritis is a chronic and a lifetime disorder. So once you have it, you will have it until you die. It just requires supportive treatment. So like one session consists of 10 treatments, and sometimes the availability of the patient, the accessibility would determine as to the frequency of the visits or treatment. Like in the rural area, there are times that we may not be able to afford to have a daily session. So we try to make sure there are even times not twice a week or once a week, depending on the availability and accessibility of the patient and the facility.
Okay, another question is, what exercises can you recommend for the patients having lower back pain?
Ooh. Hindi ako ready dyan. I think we just have to, sorry ha, but there are a lot of exercises. But one thing I would like to share as a nurse is in relation to lower back pain, there is such a thing as good body mechanics. Maintaining proper alignment of the spine is very important for relieving low back pain and treating low back pain as well. So, hindi lang kahit na anong exercise, but I think we have to consult um, a credible advisor in relation to exercises, which um, ako I'm not into it. hindi ako nag uh, hindi ako naging naka ready for that. But I think ma-share ko lang yung good body mechanics, maintain proper alignment. So one of the things that you have to consider when you do exercise is you have to maintain alignment of your bones and joints. You should avoid twisting or too much straining of the joints and tendons of your back. And if you already have the problem, you have to seek professional advice in relation to the performance of exercise. Because ako, I don't know what your specific problem is, and we would not know what that specific problem is. But if a professional is consulted, they would know which part of the spine is affected, what kind of exercise should be appropriate for you. So walang exercise that would apply to all kinds of patients with low back pain. It should fit or it should parang customize siya doon sa condition ng patient.
Can I say
Okay.
something?
Yes.
Hi, Doc. You're
Just,
there.
Doc.
Hi, Doc.
I am
Good
so sorry.
afternoon. Go ahead po.
Yeah. Yeah, regarding exercise, yeah, I think it's a very important point, ano. So I like to say something, ano.
Thank you,
Now
Doc.
regarding exercise, ano. Can you hear me? Yeah, let's say presuming the acute case of yung parang lumbar disc herniation, ano, or sometimes we call it pinched nerve, ano.
Yes, Doc.
In that case, if it's a severe pain because of the herniation, may na-protrude na disc, ano, na press ang sciatic nerve, ano. In that case, we don't recommend exercise, ano. In that
Yes,
case, I think some important acupuncture points, ano, can be very helpful, ano. So,
yes.
and in saka another thing in that case, we don't advise exercise. In fact, the best, in addition to acupuncture, one of the best important thing to do is complete bed rest.
Mm-mm.
What we mean by complete bed rest is we encourage a patient to lie down and on bed, ano. Saka iwas ang kutsyon, ano. Kung pwede to lie down on the kahit on the floor, ano. On the floor na matigas, ano. And plus acupuncture, and they will there's a very good chance to recover, ano. Kasi by resting, lying on bed, we will allow the nerve to be able to to rest and recover by itself, ano. So in that case, acupuncture and rest exercise is not encouraged. And regarding, actually, in many cases of back pain are actually muscle pain. Muscle pain. Acupuncture, well, acupuncture is good, no? It helps in relaxing the muscle, in also in relieving the pain, no? And it could the issue of exercise is being raised, no? In many cases, what they need is exercise. Hmm? Exercise. Kasi I always advise my patients, ano, na if they can come to see me and I do acupuncture and they get the pain will be relieved, ano? But again, if they don't exercise, the pain will keep on coming back. Kasi as one grows older, there's a tendency for our muscles, ano, including the lumbar muscles to go into spastic to go to spastic state, ano. So the best is really to exercise, ano. And sandali lang. Mm, mm. and and uh, and I think maybe walking is very good exercise, ano. Walking or sometimes twisting of the waist, ano, like makempot-kempot, ano, that will be good, ano. And I think Dr. Lagay is with us. I think Dr. Lagay is very good, and he can supplement, give us more
Yes, Doc.
exercises. Dr. Lagaya. Yes.
Good afternoon, Dr. Tancho Chong.
Yes.
Yeah.
Yes.
Well, sana may magde-demo dito ng ng maglakad ng kumikembot-kembot.
Si Lady. Lady.
Ete, mag-demo ka nga.
Yung dinemonstrate mo sa convention.
Yeah.
Yeah. As a neuropsychiatrist, Dr. Tancho Chong is one good person who really looks into acupuncture along with whatever nerves is happening. Kaya kung sinabi niyang limit ang exercise, of course, sunod tayo sa ganyan. Pero pag after the crisis has transpired or sa tingin niyo medyo nakaka-recover na, that's the time wherein we can recommend one exercise. Now, there are two types of exercise. One is the stationary and the other one is the mobile. So there's also a yin and yang sa mga exercise. So yin is a stationary wherein a yoga posture na nakaupo ka lang. You don't really have to cross your legs. Lahat ngayon sa nakikinig ngayon, you just straighten your spine, huwag kayo sasandal. And then for a period of time na habang nagdadasal kayo o may kinakanta kayo dyan, while doing it, that's already a yin type of exercise for the spine. Kaya pag ginawa niyo yan, in fact, I recommend that to all my patients, the last 30 minutes before you sleep is very critical. To the point na if you would sit, wag na tayo lumayo, tayo na lang, mga pamilya natin. The last 30 minutes, anong itsura natin before we sleep? Kadalasan yan yung nanonood tayo ng TV while looking at the late night show. Tapos doon, kapag naipit na yung nerves, particularly sinasabi ng Dr. Tancho Chong ni Ma'am Rochie, there's a nerve that passes through it na one of them is the sciatic nerve. Kapag naipit yan, the muscle is also naiipit yan because of the muscle primarily before we go for spondylosis, spondylolisthesis, or this herniated disc. Bago mangyari yan, ang una naiipit, umiipit yan yung laman, and that's due to wrong posture. Tama si Ma'am Rochie, it's the alignment of the vertebra that is the one causing the pain. Kaya ang advice ko for everybody ngayon na nagkakaroon palagi ng low back pain, the last 30 minutes before you sleep, huwag na kayong sasandal. Either nanonood kayo ng TV and then diretso yung likod ninyo. Like now, if you do it, you can follow right now. Or you do your prayer, which turo sa atin ng mga magulang natin nung maliit pa tayo, na you pray before you sleep. Ngayon, ang ginagawa natin, we text before we sleep. Nawawala na yung ganong idealism na nakadiretso ang likod natin. Try niyo yan, sabihin sa pasyente na stationary. I think that would suffice. Even a good neuropsychiatrist as Dr. Tancho Chong would recommend na complete bed rest. Pero isabayan na lang muna yung stationary, diretso ang likod. That's the yin type. Now, once you think na ready na ang pasyente for the yang type of exercise, yun yung sinabi ng Dr. Tancho Chong na mag-ano kayo spaghetti pataas pababa, maglalakad kayo na kumikending ang bewang. You are now realigning the vertebra along with the muscles attached to that. Ang isang term nga pala sa sciatic nerve or sciatica is the piriformis syndrome. Ibig sabihin nun, may muscle na naka from the sacral vertebra mahaba yun hanggang sa makarating sa femur, the upper part of the femur. Kaya yun namamagayan, pag namaga, naiipit yung ugat na dumadaloy, kaya matinding sakit na dinadaing ang pasyente that radiates to the legs up to the feet. Kaya if you now do movement exercise, and if you do walking, as what Dr. Tan Chuchong said, walking exercise, by the way, nagfo-42-kilometer marathon run si Dr. Tan Chuchong for your information. Okay. So if you can do such a thing, kaya idol ko si Dr. Tan eh. Alright. Saka pag nakita mong payat, hindi tabain, yan si Dr. Tan, si Sir Jackson Tan is also one na hindi tabain yan. Kaya makikita mo, magandang exercise program nila, bihira magkaroon ng sakitan sa likod. Well, ang isang advice ko na lang, kung may nag-text yata dyan, Sir Jackson, may nakita ako sa chat, na kapag takot sa karayom, ang isang trial na pinapagawa ko sa kanila, habang kausap ko nakaharap, i-massage nila ang ating UB40. Hindi ko na kailangan sabihin kung ano yung UB40, na-explain na ni Ma'am Rochie kanina. So you just massage it habang nakaupo using our fingers, middle fingers, your dirty finger. Gawin nyo yan at do acupressure on that point. At kapag biglang guminhawa ang likod ninyo, tumbok yun na ang sanhin ng sakit niya. Yun na muna. Mahirap mag-demo ng exercise kapag naka-teleconference. Okay, siguro po tama na po muna yan, Dr. Tan.
Yeah. Thank you, Doc Al, for sharing.
Here's another question. What other treatment modality can you recommend, especially for the patient having fear with needles? Yan na yun. Nasagot na ni Doc Lagaya. Let's see. There's some more questions here. Paano daw, tanong ni Leti, paano daw pagtakot sa needles? Ayan, nasagot na. Heat syndrome, di pwede moxibustion, of course. Ms. Rochie, would you like to answer?
Anong question nga yan?
Paano daw pagtakot sa needles? Heat syndrome, di pwede moxibustion. I think hindi ganong klaro yung question niya. Letty, would you like to clarify?
Di ba meron naman tayong acupressure? Pag walang takot sa needles, same points, pwede nating gamitin, but we will apply pressure, walang tusok. And I think there are ano ba yun? Techniques, yung mga needleless techniques din. I've heard about that. Na parang pressure lang din, but I think it may have the same effect because the points that we will be using is the same. Like tulad nung sabi ni Doc Al, na pag sumakit yung likod, pwedeng pisil-pisilin yung UB40 or BL40, parang gano'n na rin. But although you did not use needle, but you press the same point that could cause relief of the problem.
Okay, here's another question. How about swimming po, Doc? Allowed po ba?
Doc. Yung mga doc. Allowed po ba?
I think this must be referred.
For me, I think swimming is in general helpful.
Yeah.
It's a smooth exercise. As long as there's no contact, I think mild swimming, I think will be helpful in general. Yes. Maybe Doc Al.
Siguro lang, part of the assessment natin, di ba sabi natin, one of the cause of the problem is invasion of cold and damp. Pag yun yung cause ng problem, I think swimming will not
yes.
Cure the problem.
Yeah. Sir Jackson, may I?
Go ahead, Doc.
Swimming is good for two types of exercise. One of them is most of the rehab doctors will not recommend back pains na magkakaroon ng impact, especially also impact to the knee. So ang nire-recommend diyan would be just for you to walk sa swimming pool, yung may mababaw lang, you just walk around para walang impact sa tuhod at makaka-recover, mawawala yung kalawag ng tuhod natin. Ganon din sa upper part, sa pelvic area, sa hip area. If you do your regular walk in the swimming pool, that will be good. Now, kapag naka-horizontal ka, regular swimming, maganda rin yan for specific muscles, for the shoulders, do sa hips and the legs, meron din pero walang impact. Now, when I talk about impact, there will be a time wherein you would recommend impact training as walking, sinabi nga, or marathon run, no, walking to a patient kasi the mere fact, if you see what I'm going to be demonstrating, the impact generated by the heel hitting the ground will allow the force going up to your legs, to your tibia fibula, to your knee, to your femur, to your hips, and down to the vertebra. That strengthens the osteocytes para maiwasan ng osteoporosis pag nakakaramdam ng regular impact. Kaya yung mga bedridden patients nagkakaroon ng osteoporosis dahil wala ng impact na nararanasan na ganyan. So for those bedridden patients, sana naman makapunta man sa CR, and that's already the effort, pero it's a good exercise para hindi magkaroon sila ng osteoporosis.
Thank you, Doc.
Thank you, Doc. That seems to be the last question. If there's no follow-up, is there any more? No follow-up questions. If there's none, I would like to ask Dr. Tan Chong if he has some closing remarks. Dr. Tan, are you still there? Nawala. Dr. Tan.
Sir Jackson?
Yes,
Sir
Doc.
Jackson? Bago magsalita si Dr. Tan Chong, may nagpahabol question yata itong si Ma'am Letty natin. Okay.
Okay.
Ano daw position pag matutulog?
Go ahead,
Okay.
Doc.
So, ang tanong ko sa inyo, paano ba matulog ang kuba? All right. It's a joke. Paano matulog ang kuba? Nakapikit. The answer to that is any position that you're comfortable with, pwedeng matulog ng nakadapa, as what Letty is telling us, or nakatagilid or nakatihaya. Which one is comfortable for you? Pero sa tagal na merong low back pain yan, hinahanap niya yung comfortable position. So my advice is, Dr. Tanjo Chong already made mention, firm bed kanina, iwasan yung sagging bed, yung talagang lumang-luma na yung spring doon ay mahina na. You have to have a firm bed. Tapos yung ang importante hindi talaga sa paghiga, kundi pagbangon. Kasi according to some practitioners, ayaw ka patayuin from a supine position, nakahiga, nababangon ka on that. Ayaw nila. But for me, it really doesn't matter. Kasi mga Chinese acrobat, they would even jump from a lying position to standing position. Ang advice po dyan ay to always do a regular exercise kahit na nakahiga ka. Meaning, pag nakahiga ka, always play around with your legs, with your knee, stationary biking. Habang nakahiga, stationary biking na nakahiga, so nakahiga kang ganun, and then your legs starts to move na parang nagbabike, and that automatically loosens up the pinched nerve happening on your vertebra. So yun ang advice ko po pag nakahiga. Whatever position, bahala po kayo kung ano position ang pabor kayo.
Thank you, Doc. May pahabol na question si Jess Pitantes. Did you recommend herbal medicine sa mga pasyente na may lower back pain? Doc, would you like to answer, Doc Lagaya?
Si Ma'am Rochie po.
Okay.
Okay, so sige, Jess. For herbal meds, lalo pag yung cause ng sakit lamig at saka damp, you can use herbal meds. Halimbawa ng herbal meds na may sili na ingredient kasi warm siya, nakaka-relieve siya, o kaya ginger na mga ingredient at iba pang mga klase ng herbs na that would help in promoting circulation, because we said one of the causes is stagnation of qi and blood in the area. So pwedeng yun. Wala na. Ang tuba-tuba. Ang tuba-tuba na dahon po mas maganda. Okay, I think so. Yung tuba-tuba, gamit namin yan when I was a kid. Anyway, external lang naman. Okay lang naman, Doc, di ba? External, yung dahon, i-ano sa masakit na part. Iinitin yan sa kalayo, tapos saka ilagay.
Okay, Ma'am Rochie.
Yes,
Ma'am
Doc.
Rochie, in addition to what you said regarding the
Yes,
sili,
Doc.
it has a very good vasodilating effect. So ang hanap natin dyan, ano ang anti-inflammatory herbal medicine that we all know by now? At alam natin, ang pinakasikat dyan would be luyang dilaw, kasi
Turmeric.
proven na turmeric, luyang dilaw. Ang
Oo.
problema niya, naninilaw din pati ngipin natin at saka lahat ng utensils na pinaggabitan. Yun lang ang problema doon. Pero magandang anti-inflammatory po yan. Parang ang luto po niya, parang nilaga, na para din pong nagsalabat tayo. Along with salabat itself, effective din po yan. Along with the COVID, magandang anti-inflammatory yan for respiratory passages. So hindi lang po sa bewang, kundi pati sa respiration, makakatulong po yan at this time of our COVID crisis. Yun lang po, Mang Rochie.
Thank you, Doc. Wala na, Jackson.
Mukhang wala na. Yung medyo naputol ako kanina, yung question ba na huli, nasagot na? Yung sa bed? May pahabol kasing question si Leti.
I think tapos na yun.
Okay. Okay. So if there's no more question, I just received a message, Dr. Tan Chochong has to leave. So iniwan na tayo. Okay. Should we have a picture for this class? Hold on for a while. Okay, wear your best smile. Okay, 1, 2, 3. Okay, let me go to the next group. Okay, we have 2 groups here. Okay, 1, 2, 3. Okay, so thank you everyone for attending. Thank you, Dr. Lagaya, for assisting. Thank you, Miss Rochie, for the wonderful lessons today.
Thank you din sa lahat.
Thank you to all the participants we have today. Umabot tayo ng 50 plus kanina. Si Mr. William, nagda-drive pa yata pero nag-a-attend. Nakangiti siya. There's one thing I would like to add kanina sa sinabi ni Dr. Lagaya about your impact during running. I would want you all to give it a try if you can. It would be nice for you to try to walk, to run barefoot. This is also an advocacy of Dr. Lagaya. I've actually gone to the top of Mount Pulag almost barefoot. Nakabalot lang ng manipis yung paa ko. And the sweeper was saying when we came back down, hindi namin akalain na matatapos mo yan. But if you can do that, can you look at your hands, your fingers right now? Our fingers are capable of holding, touching, di ba?
Yes.
How about your foot toes? Are they capable of holding and gripping?
Yes.
Oh, yes? Very good. For those that cannot, that means there's something you can improve upon sa paa nyo. And if you work on your foot, that's already working your whole body. Remember our ears? You can work your whole body with your ears. If you work on your foot, you can also work on your whole body. That's the big effect. And pag nakasapatos kayo, as Dr. Lagaya said a while ago, napakalakas ng impact, hindi nyo ramdam. Lalo na pag bumibili kayo ng mga sapatos na napakamahal. It feels so soft, and yet the impact is actually still there. Di ba? Tama po ba? So, if you remove that shoe and try jump up and down, or just run 100 meters, yung first 2 meters nyo, iba yung takbo. Pero when you reach the last 2 meters, iba na rin uli yung takbo nyo. You'll feel the difference immediately. Kung kaya nyong gawin yan, right now, it's not necessary that you run. Lalo na wala pang kalyo yung mga paa nyo, maninipis pa. Kaya masusugat yan. But you practice at home, walk lightly, then you train those muscles, it becomes stronger. Yeah. Then another thing about lower back pain, muscle imbalance. Pag weak ang abdominals nyo, or very strong ang abdominals nyo, tapos weak ang lower back nyo, hindi balance yan. So there will be muscle pain that will cause you to have lower back pain. So it's very important for those that have big tummies. Yeah, hindi sa but ergonomically it's bad kasi it's pulling forward. Yung mga babaeng buntis, hindi ba nakakaramdam din ng lower back pain? Tama po ba? So, ganun din ang lalaking hindi buntis na malaki ang tiyan. Pag habang lumalaki yan, bumibigat, humihila yan sa likod natin. So, it's going to be bad for your muscles. Okay? So, we'll see you again next time, sometime in July for our next class. Stay safe, everyone. Thank you very much.
Okay, thank you very much.
Bye-bye. Bye-bye.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye.